the topic of image fusion and registration. So basically speaking, I'm going to present my efforts in fusing image data from different modalities and their application in medicine, as well as the link between diagnostic imaging and therapy. This is so-called image-guided therapy stuff, and that's what you will hear in the next 20 minutes. By training, I am a medical physicist. Medical physicists do deal with all different types of the use of electromagnetic radiation in medicine, namely either the diagnostic use in terms of X-ray, MRI and ultrasound imaging as well as other modalities, and the therapeutic use of electromagnetic radiation, that is radiation oncology, the destruction of cancer cells by using so-called linear accelerators. Basically speaking, medical image data represent mathematical function of physical tissue properties. Some of these properties may include the atomic number of the molecules in the tissue which govern the absorption of X-ray. And this is of course the effect one measures in X-ray and computed tomography imaging. Computed tomography is, so to say, a three-dimensional version of the X-ray imaging you all may know. If we talk about magnetic resonance imaging, we're measuring a quantity called relaxation time, which is directly correlated with the density and mobility of protons and other nuclei with odd mass number. If we measure the variation in speed of sound and the amplitude of sound as it is being sent into the body by a so-called ultrasound scan head, we're dealing with ultrasound imaging. And if we measure the activity, the physical quantity is actually becquerel, of a very low amount of a radioactive substance in the body, we're talking about nuclear medicine. In image processing, we are applying mathematical methods from numerical mathematics, of course, on these measurements. And basically speaking, we consider all the image data we have to be functions which are related from a two- or three-dimensional domain, so either pixels or voxels, to a density that is related to the measurements we have. Image fusion or registration is a set of techniques which are applied when so-called hybrid imaging devices, which measure several quantities at one point in time, for instance, a modality from nuclear medicine called PET, positron emission tomography, and computed tomography, is not available or cannot be applied. So if we want to have a common frame of reference for image data taken at different time points, for instance with a few months in between, to see how a tumor is being, how a tumor reacts to a certain type of treatment or something like that, we have to do image fusion in order to get a common frame of reference for the image data so that we can compare the image data. And there's also application which I will show to you where we fuse image data of different dimensionality, for instance three-dimensional computed tomography data to two-dimensional X-ray data. And finally, we also want to find a common frame of reference to the situation, for instance, in the operating room. And this is what we call registration of image data to reality, which is at the very core of image-guided therapy. My own research in this area includes different topics such as image fusion in surgery and radiotherapy from multimodal images, also registration of three-dimensional and two-dimensional images, as well as images which were deformed in between acquisition, for instance by a change in anatomy of the patient, as well as what we call image-guided radiotherapy, registration and tracking of interventional instruments in a field we usually call computer-aided surgery, and a topic that is called augmented reality, which deals with the visualization of data in additional devices such as head-mounted displays. So this is a video that's, I have to admit, it's more than 10 years old. It was taken during my PhD. During my PhD, I developed a computer-aided surgery system for implantation of artificial teeth in patients that underwent either radical surgery for removal of a tumor and needed some anchor to place an a prosthesis of some kind, or for people that simply lost their teeth. So, and what you can see here is actually an optical probe that is an assembly of light-emitting diodes that tracks the position of the patient's mandible and the position of the surgical drill used to drill the channel for the implant, which is basically speaking a small screw. In the end, you see how this drilling process takes place. What you see in the illustration in the middle of the slide is actually a screenshot from the software. During surgery, the optical tracking system followed the three-dimensional position of the drill relative to the mandible of the patient, and the surgeon could see with an update rate of approximately 2 to 3 Hz how he progressed in comparison to the preoperative planning on the computed tomography dataset.